Hello everyone. Today we will discuss an important topic, instrument, and see what exactly it is. So what this instrument is. So look at this. Very commonly used, especially in the abdominal surgeries and other major surgeries where we want to keep the wound widely open to have a proper dissection and procedure, surgical procedure. So this is a very common, lightweight, simple instrument. What is this instrument? So look at that, how exactly, just remember it is kept in the exam, viva, it will be asked, and day-to-day surgery, major surgeries, it is being used both in general surgery as well as obstetric and gynecology. So it is Balfour's self-retaining retractor. So what are the features? It has got a sliding blade. See that this is the beam. See that here. See that here. This is the beam. See this beam. See that this is widening. So there is a sliding part here. So this can slide like this, and which can be fixed and with the plate and screw. Here is plate and screw is there. This one. So it is get fixed there. So these blades will go into the abdominal wall like this. So you can widen, adjust the width, whatever you want to, depending on the length of your incision and width which you would like to have so that your visibility and exposure of the deep area, especially in the abdomen, maybe sometimes in the thorax, where commonly we use a finituity retractor. So this is being used in the pelvic surgery also. It can be used. So so this is what are the uses. So used in the abdominal surgeries, I already told, retracts well. See that? This is the retraction here, both sides. So this beam you can here see that a sliding beam it is the plate here. Screw is here actually. This screw is here. Careful, the screw should be monitored, and while coming out, the screw should not fall into the abdominal cavity, so that you may miss it. It may cause a legal issue. That point is very important. Should tell the sister, take care of the screw, staff nurse that take care of the screw. So it's a very simple instrument. This is the blades which goes into the abdominal wall, and so that retracts adequately. So it's a self-retaining retractor, not manual. So assistant's hands are free. So otherwise assistant has to hold the retractor, like in Beaver retractor, Morris retractor. They're manual, so somebody has to keep on using the force. Where here it is self-retaining, it stays there, and so assistant will help you for other procedures, like suctioning, ligature passing, mopping, and other things. Because so there is assistant's hands are free because of this self-retaining retractor. So widely kept open this abdominal wound. So very simple, cheaper instrument, but very useful, helpful. In any hospital in taluk side or any hospital it can be used. So very useful, self-retaining retractor. Actually it is. This is Balfour's self-retaining. Spelling, remember, Balfour's self-retaining retractor. Exam full right. And why also they will ask, in instrument section they will ask. So remember, this is very commonly used instrument, especially for abdominal surgery. So all of you know that my SRB clinical methods in surgery with the video lectures. You can always go through for a different thing. Instrument is there in that. Manual of surgery details everything about the subject and topic, and A to Z current CBME for UG and PG also it covers in detail with the case scenario, MCQs, with the instrument specimens, X-rays and so on. Brief operative surgery, small one. My operative surgery book in detail, any operative procedures you can go through that. Tissue approximation, of course, that is also a small book, atlas with the skill, with the video narrated very well, basic suturing technique. And DigiNor is my video lectures through JP Publishers. All lecture, all or surgical topics, everything with the clinical examination and X-ray instrument, operative procedures discussed in detail. You can always subscribe that one for a year, and so for your essential final year MBBS exam, or PGs for their final year near exam for the understand the surgical carriers to have a easy lectures. So students, I hope you understood this instrument very well. Thank you very much.